I am Dr. Alain Ngoupo. I have a PhD in molecular and the biological aspect of biology from the University of Rouen in France. And currently I'm a research scientist working here at Centre of Cameroon for about 10 years. My research focused on the HIV, which is one of the top priority diseases here in Cameroon, because about 500,000 of people are living with HIV here in Cameroon. So my work focused first on HIV drug resistance in order to provide update data to the Ministry of Public Health to inform policy on our antiretroviral therapy in Cameroon. Secondly, my work also focused on HIV genetic diversity, because HIV is extremely diverse here in Cameroon. So I aim to characterize the different strains that are circulating in the country, because this impacts the diagnosis, treatment, and also follow-up of people living with HIV. And thirdly, I'm working also on HIV cure, trying to build a conducive environment here in Cameroon in order to enhance research on HIV cure in the country, but also in West Central Africa. So by carrying out this research activity, I aim to contribute to enhance and improve life of people living with HIV, not only in Cameroon but also in Africa. I joined SANTHE in 2022, so 3 years ago, as a SANTHE supervisor for supervising a master's student. And SANTHE had helped me to participate or to attend training English courses in order to improve my English, but also I also have the opportunity to get some funding for SANTHE to carry out some research project. We can give the example of the SANTHE collaborative grant I received last year in order to conduct HIV and research on HIV drug resistance in children living with HIV here in Cameroon. So like other scientists in Africa, carry out research in Africa is not easy, because we are facing some challenges. This is including access to funding, infrastructure, because we don't always have the state-to-art infrastructure to conduct research here in our setting, but also training and mentorship, and the networking and collaboration. Unfortunately, through SANTHE, I was able to access some funding or opportunity. Like I just said, I received some funding from SANTHE to carry out some research on HIV drug resistance, but also on HIV diversity here in Cameroon. And talking about infrastructure, through SANTHE, we got a funding to purchase or to acquire digital droplet PCR platform that will help us to perform laboratory analysis related to HIV cure. So we will not send our sample abroad in order to carry out this research, and we believe this will greatly enhance our research on HIV cure. And talking about training, I was fortunate to be part of the first cohort of SANTHE Leaders Program Fellow, which help us to improve and provide us with special skills related to leadership in science. And through this program, I established some collaboration with my fellow, and we are currently working on the research project that we will be submitting to the AIDS funds. And also talking about mentorship, I was fortunate to working with Dr. Marcel Tongo, which is the SANTHE PI here, who is helping me daily to establish and enhance my scientific knowledge in order to establish myself as an independent researcher. So this is just to show you how SANTHE have helped me to foster and to advance my my career. So I would like to take this opportunity to thank SANTHE, especially Professor Tumbi, for this opportunity and this initiative. Victoria, who is the program manager of the SANTHE, Dr. Marcel Tongo, who is not only the SANTHE PI but actually my mentor, and also all our funders.
My name is Vale rie Donkeng. I'm the head of the microbacteriology unit at SANTHE Cameroon, and this unit hosts the National Referral Laboratory of Tuberculosis in Cameroon. I have a PhD, and then I work on microbacteria since more than 13 years. I work on several projects, and one of the exciting ones is related to latent tuberculosis infection. According to the WHO, 1/3 of the world population is infected by mycobacterial tuberculosis. One of the strategies of the NTB is to be able to tackle the pandemic by 2035 by reducing or by breaking the transmission of the disease. And one of these strategies is related to identify as early as possible latent TB infection to avoid the development of the disease, from the infection to the disease. So I'm working on new biomarkers that will help to identify latent TB infection. I joined the SANTHE since 1 year, and I was really glad this year to receive the support of SANTHE to attend the annual consortium meeting in November 2025. And this opportunity will help me to meet, to discuss with other researchers of the consortium, and together we will build a strong research collaboration to work together related to the TB or mycobacteria diseases. As a young scientist from Africa, I face challenges, and those challenges are related to language barrier, some related to infrastructure, and some are related to reagent. As you know, for some application or for some project, you need preliminary results to be able to prepare your concept note or prepare your full proposal. And I really appreciate SANTHE, because I am confident that this opportunity will help me to overcome these challenges.